Yeah, got it.
Take one.
Can you briefly frame the climate and health problem we face?
Millions of people die every year around the world from the impact of climate change and pollution.
We hear about global warming, but it is also a public health crisis.
We're also witnessing a steep rise in heart conditions, cancers, respiratory illnesses, and infectious diseases linked to environmental factors. The paradox is that the health sector is part of the problem today. Emitting about 5% of greenhouse gas emissions globally is actually contributing to the climate crisis more than the aviation sector. But we can also be a part of the solution. We can actually make more sustainable choices to deliver health care. We have to act not next month or next year, and not by the end of the decade. We have to do it now. My name is Pascal Soriot, and I'm the CEO of AstraZeneca. The direct impact of climate change on the life of people is very personal to me because I've seen it with my own eyes in Australia. We had tremendous bushfires. The city was covered in smoke, and it affected life. So those climate changes really have a direct impact today, not tomorrow, today already, on people, their life, their health, and the economy. The problem is always, how do you move from the realization of something to, okay, I'm going to act. AstraZeneca is a science innovation company, and we really want to improve the health of people. The production of our medicines is taking place in factories that are energy intensive. So that's really where you need to start. We want to be a catalyst and hopefully inspire others in our industry and beyond to do something about this climate crisis. I really want my grandson and his generation to not experience a life that is affected by climate change. And the future is theirs more than it is ours. We see the greatest level of energy coming from our young employees.
I grew up on a farm, growing up with animals, with the crops, with the land. That gives you appreciation for nature and what it can do. It also shows you the fragility of nature. Nature's not there as it used to be anymore. When your whole livelihood depends on the external environment around you, you have a sense that you want to protect it. I am a supply chain degree apprentice here at AstraZeneca. The energy requirements for a site like this are massive. Things like the robots that we use, the packing lines run 24/7. Think about the amount of energy that's just needed to light those buildings, to heat those buildings. AstraZeneca is moving towards having green gas fuel for our UK sites. Crops such as barley, maize and rye going into essentially what is a porridge pot. And these will slowly start to decay over time, and the gas that is produced off that, which is biomethane, that will be taken off, put into the grid, and Macclesfield will be using that to fuel places like this, our manufacturing sites. Excess byproducts go back into the chain, so will be used in farming again, will be used as fertilizer. So everything's used, and again, that's really personal to me because it's farming.
We as human beings, we live in an ecosystem where everything is connected. So nature is really a very important friend for all of us. Stopping deforestation, restoring degraded forests would provide about 30% of the solution to fight climate change. We are committing $400 million to plant 200 million trees. We want to restore biodiversity and partnering with local communities to support up to 80,000 livelihoods.
It sets an example, and that will hopefully become the norm. There's a lot of hope.
I work in an industry that is about innovation. Very often it's a result of accumulated work and accumulated knowledge. The SMI, or Sustainable Markets Initiative, is a group of private enterprises that were brought together by His Majesty King Charles III when he was the Prince of Wales. Every industry represented in a different task force. And I have the pleasure and the honor to lead the healthcare task force to look at how we collectively can work to reduce carbon emissions.
I heard of Pascal's work on SMI, so we got together and say, let's learn from each other. Then we brought other people together, some 70 different groups, to start working on how to change and improve healthcare delivery. I think that we need everyone to say, let's do it together. As a physician, we took the Hippocratic Oath, which means we not only need to reduce suffering and save lives, but we must do no harm. That's why it's so important for us to take responsibility to decarbonize.
If you become sick and you have to be hospitalized, of course it's not good for your health, but then you generate a lot of carbon. So really we need to work together to reduce that. What we can do to reduce it is, first of all, keep people healthy.
Climate crisis is the greatest health crisis of our time. I want my grandson to look back at the work his grandfather did and be proud. I want him and his generation to live in a safer and a healthier world. It is on each of us to play our part to ensure that our planet not only survives but thrives.